Thank you so much for being with us. My name is Dr. Tissa McGee, and I will be one of the facilitators tonight. I've devoted my life's work towards improving the quality of life in many urban communities, especially those here in Miami. I'm an associate professor at Barry University School of Social Work, and I teach trauma-informed social work practices, social systems, research, leadership, and public policy courses in the Masters of Social Work program. I also lead in the Promoting Wellness in Marginalized Communities initiative with the School Center for Human Rights and Social Justice. At the core of my work, I help to build community systems using engaging and empowerment techniques. I also own my own consulting firm, MC3 Consulting, which celebrated 10 years, and I aim to advance communities in that work. Thank you for joining us tonight. I want to turn the program over to my co-facilitator, Dr. Maria Teahan.
Thank you, Dr. McGee. Thank you. Welcome, everyone. Dr. McGee and I are honored to be with all of you here tonight in what we hope is a way to join our community towards the path of wellness. My name is Dr. Maria Teahan. I am a licensed clinical social worker and associate dean and assistant professor at Barry University School of Social Work. And like Dr. McGee, my passion is in working with our communities. My research and practice is focused on traumatic grief and loss and working with first responders and the military. So today we welcome you to the first of 4 workshops that we plan on providing for and with the community. And I intentionally say with because we want to create a place, a safe environment in this remote reality where we can share our ideas, our stories, and we can help and learn from each other. Today, what Dr. McGee and I plan on doing is that we briefly and let me share with you our PowerPoint. We'd like to first welcome you and also go through some of the numbers that we know. We want to talk a little bit briefly about how COVID entered the United States, how COVID entered Miami-Dade. We want to talk a little bit about the numbers and also then move into what we believe is the real thrust of today's meeting, and that is listening to your voice, hearing your stories. And we hope that we can hear from you and have a dialogue and continue that dialogue in our next 3 modules, our next 3 workshops that we hope to continue for our community. So let's get started. Let's talk a little bit about how COVID entered the United States. So we all probably have heard a little bit about this. We know that in February, our reality as we know it changed when in Seattle, the first official COVID patient was identified. And at that time, we knew that it was spreading to about 4 people and averaging every 4 days, spreading to 4 people about every 4 days. Here in Miami-Dade and in Florida, around March 1st of 2020, the first 2 cases were identified in Orange County. And then shortly thereafter in Miami, a man was diagnosed and they tracked this through his travels. At this point in time, Florida, as we continue with the changes in the seasons and so forth, we do know that because of the cold weather increasing, Florida has now become 3rd in the nation with 4 other states. And these states include New York, Georgia, and South and North Dakota. And what we're finding is that these 5 states actually comprise 40% of all COVID cases in the country. So we know that the issues are here. We know that it's important to be able to understand the history of where we are and how we got here. And I wanted to talk a little bit about the numbers here in Miami-Dade.
I think it's really, it's important for us to emphasize that looking at this through this historical lens is an important part of our discussion and an important part of the story of why, we are all so impacted by what's happening now. And I think the details that surround that about how it got here to the United States and to Florida and specifically into Miami-Dade County is going to help us to understand, where we are now based on our past. I think a lot of times we forget to include that historical context. So I appreciate that that you're bringing that important point to light.
So I think that within the context, I think you're absolutely right, Dr. McGee. And I think within the context of the realities that we're facing, I don't think that as a country we were prepared to understand how impactful this reality of bringing of the pandemic was going to be. And I think that part of the message that I hope we can move forward as we continue today is understanding the impact of the pandemic within the context of how we all live our lives and how this not only impacted us as a community, but individually. I really hope that today we offer an opportunity to our participants to share some of those individual stories. And as we move through the next 3 workshops, although they stand alone, our hope is that they continue to build on this story. They continue to talk about how the historical perspective of the reality of the pandemic. And for us, it isn't, people don't come into these experiences in a vacuum. They come to it with all of their values, their beliefs, their experiences, their realities. And because of that, how we respond or react to the pandemic, I think, is in context to that situation. Not only are the historical perspective and the medical or physical perspective of the pandemic, but also how has this impacted our mental health? I know that Miami Today reported that what they found in a survey that was done recently, they found that 3/4 of the people in South Florida who had been surveyed stated that COVID or related issues had impacted their mental health. And so I think it's a topic that's really important to bring forward. And I hope that that's part of what we can do today is create a dialogue. So let's talk a little bit about the numbers. By the way, this is a dashboard out of the Florida Department of Health. And you can access this not only on miamimatters.org, but also on our website, which is mymentalhealthmiami.com. But I wanted to bring this forward a little bit more in terms of understanding the reality of what we're talking about. And these numbers are as of October 27th overall in Dade County. And I probably by today, I think when I looked at the dashboard earlier today, the numbers were higher. So it was about anywhere from 1,000 to 2,000 people higher. So right now, roughly, we're at 180,000 cases in Dade County. As of today, there's actually 671 cases of COVID reported as of today. And although that's down from one of the highest, which was in August of 31, which was over 2,000 people, it's also high. It's already increasing from the lowest that I've seen, which was September 27th. We were down to 71 cases a day, and now it's going back up. What we have found is that the median age is now decreasing. It's 42. Females have a higher percentage than males. And in terms of cases by race, in Miami-Dade, Caucasians are now at about closer to 80,000 than I reported back in the 20s in October 27. Blacks are over 15,000, and others are over 25,000, and the unknown factors are over 63,000. Now these categories are based, these aren't our categories, these are categories reported by the health department. So I wanted to share that, and out of those races and ethnicities, what we have also found is that non-Hispanics are over 26,000 cases, and Hispanics are over 89,000. What I think is important about these numbers, and the reason that Dr. McGee and I wanted to bring some of these numbers forward, isn't so much in terms of the numbers, but in terms, I think, of the humanity attached to that. These are individuals, these are human beings that have been impacted, and therefore families, and within that context, in our community. And again, we bring this back to the reason we're hoping what we're hoping to achieve here is that connection is not only certainly bringing forward the opportunity to dialogue with each other, but also to understand the impact of this from a human perspective, that this isn't just a case, it isn't just a number, but these are human beings that are being impacted. And I think that that's our hope today, is to bring that narrative forward, that story. What is your story? How have you been impacted? How has COVID changed your reality in your life? And then how can we together help each other, learn from each other, and move through this, because it isn't going to end tomorrow. And how can we do, what changes can we make? What can we learn, both short term and long term?
Maria, I think it's important to also know that these numbers, like you said, represent actual people, but to also realize that numbers can sometimes be overwhelming for people. Mm-hmm. And I know just on media exposure and people watching the news and seeing things like the numbers of cases here locally, and then nationwide, and then globally, right, can be an overwhelming experience. And that in and of itself can cause some of that stress and anxiety and things that we want to help approach as we talk about how the pandemic has impacted our lives. You mentioned a questionnaire, and I do want to just make sure that people also knew that that we are providing a survey as well through this project and program, making sure that we are capturing some of the issues that our Miami-Dade County residents are facing as a result of COVID. So we want to also encourage people to go to mymentalhealthmiami.com to participate in that questionnaire and answer that survey.
One of the things that is really important about this discussion is this idea that our worldview changed when the pandemic entered our lives. And what I mean by that is, I think most of us sometimes just kind of, we do the best we can. We live our lives, we have our challenges, but there's always a sense of maybe a safety net in some way, that these things may not happen to us. And I know that in my own circle, as we saw this unfolding globally in Europe and in Asia and so forth, there was almost a sense, well, that's not going to happen here. And then all of a sudden, the reality hit us. And not only did it happen here, but it's everywhere. And I think that dramatically impacts our worldview, how we envision the world, how we envision our lives, how we come out of this safety bubble in respect of, this not happening to us. And we realize that the vulnerability exists, that this can happen to all of us and can happen to any of us. And indeed it has. And so in that respect, I hope that we can move into some of the stories that have happened. And, we had found this quote by Iryana Banzan, and it said, "It's important that we share our experiences with other people. Your story will heal you, and your story will heal somebody else. When you share your story, you free yourself and you give other people permission to acknowledge their own story." And I thought that was very powerful. I think that this is where we want to go, which is, what is your story? we want to acknowledge that something dramatically has changed in our lives. We want to acknowledge that. As essentially a grief counselor in terms of my own practice, working with grief and loss, to me, everything seems to be in a filter of that, whether it's positive or negative. Change creates a sense of loss in us. And so I thought it was important for us to bring forward that acknowledgement of our pain, not only individually, but collectively as a community. And within that community, other sub-communities that exist, that are created by our own identities. And so I thought it was really important that we acknowledge that we acknowledge the pain of this, that we acknowledge that our worldview has dramatically shifted, that the vulnerability doesn't feel comfortable, where it's frightening, but I also wanted to hear this. I thought it was also important to hear the other piece of that, and that is the incredible resiliency and strength and courage and endurance that people have shown throughout this 7 months of our new reality.
Maria, I can definitely share, some of my own personal experience related to this pandemic and the fear of family members who were significantly impacted, having to go into the hospital and not having the ability to go and be there with our family member. Thank God they were able to survive that experience, but the helplessness of that time, I think, is something that will never leave me. That won't ever be able to escape that thought. And so I know so many people have experienced or have been impacted by COVID, really have had different results, and it can be devastating to families. I just wanted to share my experience. If we can help to get any of our other attendees.
I want to piggyback while we're waiting to see if we can let me see if we can bring our attendees forward. I want to piggyback on something you're saying, and I think that it speaks to the uniqueness of everyone's journey through all of this. I mentioned earlier that people don't come into these change experiences in a vacuum. They bring forward everything that they are, all their experiences. And so with that is the uniqueness in terms of race, ethnicity, values, beliefs, faith, traditions. And I know that because of my work in terms of grief and loss, as I said, one of the things that I often work on is when people are, I work a lot with hospices and so forth, and bereavement. And so one of the experiences, both as a clinician and a niece that I experienced just this past weekend when my aunt passed away, was not being able to be present. And in my family, in my belief system, that is unheard of. We have to be present. We have to be there and walk that journey with people we care about. And not being able to be there and not being able to be part of that, and at least in the way that we obviously are used to and expect, we had to do it virtually. We had a wonderful social worker actually helping us, and they set up a virtual environment where we could be with our aunt. But I think part of the other piece of this journey is having to shift how we think and how we even shift our inherent values. And that, I think, is one of the most difficult things I've heard in terms of people I've been working with, but also in terms of my own family. and dealing with the aftermath of, was it okay? Did we do the right thing?
Right.
What could we have done better?
I want to say that we could also, if you're watching this on Facebook or you're viewing this after we have completed this time, we will be doing multiple modules. We'll be back together next week. So please feel free to share your story if you're open to doing that, and we'll be more than happy to address some of the things that we see, in our next module, and give people some feedback and some time to think about it too. Sometimes it's difficult to even capture your thoughts, to be able to share them, and maybe even wanting to share them in a venue like this. But our thought is that, we want to make a safe space for people to really think about and look at the impact that COVID has had on their lives, and in ways that we can, again, really be helpful. I think that's the number one thing that Dr. Teahan and I are really here is to help facilitate looking at that impact and how we can find you the right resources or tools or things that you might need in your life to make this better. So,
McGee, I think we have a question. Let me see. I think one came forward. I worked in the hotel industry and lost my job because of the pandemic. Even before the shutdown, it seemed like no one wanted to talk about the fact that people could die. I have asthma and I was really scared of contracting it and can't help but feel. I can't read the rest of it. It's not allowing me to open up the rest of it. But I appreciate your courage in presenting that story, because I think your comment really speaks to what we are talking about. I don't think it was that people were unkind, especially in the beginning. I just don't think that people fully understood how this was going to impact us. And I think part of what you were experiencing, I apologize, I'm going to call you Kinderlei because that was your name. I think that part of what you experienced there in terms of people not really wanting to address it was this idea of control. I think when we feel that we are not in control of our environment and things around us, as Tissa mentioned earlier, I think there's a sense of helplessness. And as we move through these last 7 months, I think there's also a sense that people then started to move in as we got saturated by all of this information. I think people started to feel also hopeless. And when you yourself are compromised medically in some way, and you feel that the people around you are not paying attention to the message, which then creates a different level of vulnerability in you, I do appreciate what you're saying, because then not only are you concerned about family and friends, but you're also concerned about your own health. And I believe that that's part of the vulnerability that we all felt, certainly not to the level that you may have, because obviously there was an additional underlying condition that you were experiencing pre-COVID that made your vulnerability so much more real. But I believe that that's part, when I talk about the world you and the change in that, I think that that's part of what I'm saying in terms of this safety net kind of gone, where all of a sudden we had a sense that any one of us at any given time could contract this. And we weren't sure, because even our leaders and the scientific community weren't sure. How were we getting it? How could it be passed on? Could there be immunity? Could we get a vaccine in time? And so I think that part of the unrest and the sense of fear and this sense of deep vulnerability was partially created by that idea that people didn't know how to respond. And sometimes, as you so eloquently stated, they were acting in such a way that they actually were putting other people in jeopardy. And we heard that through the idea of not wearing your mask, people not wanting to social distance, and so forth. What are your thoughts there, Tissa?
I was going to say the last part of that person's comment was the fact that they felt that led to them losing their job. Mm-hmm. And to me, I think what resonated with what you just said to me was it felt compounding. Like there were things that just kept adding to the level of stress and the impact. And so all of these things piled up on top of each other, you know, the risk of being, you know, a necessary worker or employee, the risk of putting your life in danger, and then losing your job on top of that, or possibly, you know, not being able to support your family. That all can be like, you know, tremendous levels of stress, right? And so for us to think about this in the context of like, we were just compounded and drilled every day with some new piece of information, something else that as we were learning more about this pandemic, that we, you know, it had a different type of impact on us. So I think everything that you just mentioned, you know, on a compounding basis is really why this impact is so much more significant than any other level of stress that you might have had in your life prior.
And it changed everything, right? It not only changed our own personal life, it changed it changed everything around us, and it changed even our resources that we might have at some point talked about. So, for example, if I were to say to someone, if I would, oh, you know, you're not feeling well, well, go to your physician. Well, the doctor's offices were closed. You weren't able to do that. As you said, essential workers, you know, being put in jeopardy, families. And because of that, families not being able to see each other. I have a friend who's a trauma nurse at Memorial Hospital in Hollywood there. And there was a time when she hadn't seen her family in like over a week. And because of the quarantine situation, I've known people who have had to go into quarantine because of their jobs and hadn't seen their families, or people who have lost their jobs and then roles have been changed in families where breadwinners are no longer breadwinners, or income that was coming in that was essential for survival no longer coming in, and families trying to and caregivers and parents trying to figure out how are we going to survive another day. And when we speak about caregivers and parents, the whole idea of schooling and the change that occurred when all of a sudden parents were thrusted into having to have their children and school their children at home, and you then had to decide, do I go to work or do I babysit my child? And because my work may have been impacted, I may not even be able to afford to pay someone to take care of my child in order for me to go to work. So I think there was these real, aside from when we talk about these practical applications of the pandemic in terms of changes in, you know, our lives, there's always a connection, I think, in terms of the loss of it, the mental health piece of it. It has created opportunities for people to feel anxious, to feel depressed, to worry about the future, to worry about the present, to worry about how will we move through this. And so I think your statement and what our caller put so eloquently, like I said, in terms of her experience, is in that statement, she not only addressed the concerns in terms of the physical, but the concerns in terms also of the emotional, and may I say even the spiritual for those that, have a connection to that divine. So I think this is a multi-dimensional experience. And
We have another comment, and I think that this really puts it right on target too. This person said, I realized early on in the pandemic, it was my sense of helplessness and not knowing how to help others that led me to sleepless nights. She asked, can you speak on how feeling empathetic and helpless can impact sleep patterns during COVID-19? I thought to myself, in terms of feeling helpless, I think it's also, just the change in your daily routine of being, so active and not that also kept me up at night because I didn't have a purpose in some sense, during some of that time. And so that's what it felt to me in terms of also feeling helpless. So maybe if you can address that from a more clinical standpoint.
Well, I think I first want to address the empathy piece, because that's what I'm talking about. I think that, we hear a lot of the negativity piece of that and how horrible everything is and how horrible everybody has been to each other. But the truth of the matter is that the opposite is true. And what I have found and what I've seen and what I've talked about, and I've done a lot of consulting work in the last 7 months to other organizations across the country. And one of the things that keeps coming forward is that people genuinely care about each other. And so I want to validate for you that your caring, your empathy is part of why we hurt. The reason we feel vulnerable is because we care. If we didn't care about something, then it wouldn't matter. So for me, that empathy speaks to the level of humanity that you have, and that is beautiful, but it's also painful because it hurts. When we care about something, it has the power to hurt us, right? On the other aspect of that, I want to talk about this helplessness and the sleep situation. And if you'll forgive me, I'm going to go a little bit into trauma, and I'm going to go into a little bit about how the brain works. And the reason this is happening, part of the reason that people may experience either sleeplessness or some of those types of changes that certainly create physical changes, but also create opportunities for emotional changes. So if you're not sleeping well, if you're not eating well, if your routine has changed in some way, it also can then tend to create anxiety in us, because then we feel, well, wait a minute, what's going on with us? So part of the reason that's happening is because when our brain doesn't understand, and I want to first say a disclaimer, which is it's not about you going crazy. This is real. This is actually how our bodies are hardwired to respond to traumatic events. And what our brain tries to do, it tries to close the loop. If it doesn't understand something, it tries to find the easiest path to that story, and it tries to categorize it in a little box, and it tries to find its most simple answer, and then it tries to close the loop on it. Okay, it has to have a beginning, a middle, and an end. All of these things are something that the pandemic isn't able to offer us. So let me just say that your sleeplessness is just a symptom. It's an expected symptom. It's a normal response to an abnormal situation. We are in an abnormal situation. This is a trauma. This is what trauma is. And so therefore, what happens is when our brains can't close that loop because we're not sure where all of this will end, it tries to find its own answers. And that's where that anxiety may come in. That's where the sleeplessness may come in. That's where the worry may come in, or you may be even having nightmares, or you might find yourself what we call ruminating, constantly thinking about something. It may not necessarily be pandemic, but it may be something that has really started to worry you because you're feeling so overwhelmed with everything. So first, I'd like to validate that what you're experiencing is normal. It is your brain, it is your body, your mind, body, and spirit. And and we believe that that is not able to be separated. So we believe that people come into these situations connecting the mind, body, and spirit. And because of that, you are trying to work this through. So in a few minutes, we're also going to talk a little bit about some of the things we can do. But please know that this is certainly normal in this response. I would be surprised. And I think through these last 7 months, I think all of us at some level have experienced sleeplessness, worrying about helping others. And I know this may sound oversimplistic, but can I say that sometimes there isn't anything necessarily to do except to let people know that you're there. I always tell the families I work with, I can't take the pain away from you, but I'm going to walk this journey with you. So I think if we know that there's somebody walking this with us, then the pain or the journey is a little bit easier to bear. Then we know that there's some sense of stability in the chaos, if you will. And I think that's the very best right now that we can try to do for each other. Let's try to give the message, you're not alone. And secondly, let's together try to stabilize whatever the chaos is, because we can't control the pandemic. We don't know, if that was possible, we would have done that a long time ago. We would have pushed a magic button and we could have done that. But so we can't control the pandemic. We can't control how the resources we may or we may not have. But what we can control is our response to it. We can control how we then respond to a situation, how we respond to each other, how we respond to a concern or something that feels distressful. That creates a dis-ease in us, right? So that's where the word disease came from. It simply means that our mind, bodies, and spirits are not at ease, are not in our comfort zone, and we're not in our comfort zone. So a way to do that is to create stability in the chaos by trying to break this up into small pieces. What can we control? What can we reflect on? And certainly caring about people. And it may just be something as simple as calling somebody or Zooming with somebody. It may be writing letters. One of the things I did this past semester. So I'm also a professor, as I shared at Barry, and we had to teach on Zoom, and that wasn't something that I was literally comfortable with, and I missed the connection in the classroom with our students. And so one of the things, I couldn't figure out what I could do to kind of bridge that technology gap. And so what I did is I wrote them letters. So I wrote them a little letter, I got a little card, and I wrote them a little letter, letting them know that I was excited about, teaching them and being in the classroom. It was a little thing, took me, a few minutes, but getting that hard copy somehow or another, I wasn't even aware that it would make such a difference, connected us in a different way besides technology. And again, I think that's another piece that we miss, is that physical connection with each other. Human beings, crave that, and I think are hardwired for that. So don't underestimate the small things that you do. You don't have to build a castle, put in a little brick, and together, step by step, if we stop looking at the staircase, we can't do anything about the staircase, but maybe we can fix the stair, that particular stair, that particular day. And together, I think we can then start moving through that staircase into healing. Because what we do believe in is that people have the inherent strength and resiliency to recover and to heal and to move into that healing journey. And that I believe in my heart. And do we have another?
Yeah, just another quick question. Are there any local mental health stats related to COVID that have been deciphered by researchers? And I think this is an excellent question, a question that I haven't seen any of the data released about, specifically about mental health. I think that's one of the reasons why we tried to get associated with this project and really give people an opportunity to provide their own feedback about their current mental health status, and to give us a little bit more detailed information about what they're doing to cope and to work on, how this is impacting them. So I don't know if you want to share anything additional that you know about the statistics.
Well, it's interesting you said that, because just earlier this week I was reading one of our local newspapers, and I kind of mentioned it at the beginning, that in a survey that was recently done in South Florida, they actually found that 3/4 of the people that were surveyed, I believe, is what they stated. They found that half of those individuals had been impacted by COVID in terms of increasing their substance use and alcohol. So I think that this has been this journey that we've all been on in terms of the pandemic, where it created isolation, where it created inability to access the resources that we might usually have here in our community, really has then placed individuals in very vulnerable positions, especially in terms of their mental health. And like you said, Tissa, this is one of the reasons we got involved as a School of Social Work in this project, because the message, and I loved the message that RER Consulting brought to this project, and that is moving towards a path of wellness. Again, I believe in that. I believe that people are inherently capable of it, and it does not take away the pain of it. It doesn't take away the pain of the journey. There's no quick fix in this. And I believe that's another issue in terms of the pandemic, is the sustainability of anything we do.
Right.
We can make any kinds of changes. We can talk about resources. We can talk about counseling or supporting each other, utilizing the resources you might have access to. For example, churches, synagogues, mosques, next door neighbor, your family, a mental health, behavioral health specialist, social worker, mental health counselor, psychologist, so on and so forth.
So I know that the tools for coping and managing crisis are up on the screen right now. I know we're going to go into that in workshop 4, but what are some things that people can do to help themselves right now as we continue to deal with some of these issues?
So we did put some stuff up here, so thank you for directing us there. I do want to mention that in our workshop 4, our 4th workshop, which is the last workshop, we're hoping to really take some of these coping and managing strategies that we just are really kind of talking about here, and really tease them out, and even hopefully do something more experiential, teach the participants actually how to develop some of these things. But I know this may be tongue-in-cheek and may seem a little oversimplistic, but we first do want to make sure that we're following the protocols of the CDC, and that is wearing a mask. Interestingly enough, people may not realize that of everything that the scientific community has found, wearing a mask is probably number 1 in terms of mitigating our exposure to COVID. Practicing physical distancing, and certainly contacting our healthcare provider if you are concerned that some of your symptoms may not be going away, or you may be experiencing some of the symptoms that can mimic COVID. So please make sure you're communicating with your healthcare providers. Many of them now have opened up, are seeing patients, and or are providing telehealth, and so please communicate with that.
We have another comment, and I think it's related to some of the tools that you're mentioning now in terms of using them for a long-term type of impact. So someone said that they heard that it may be until 2022, which I heard that this morning as well.
Me too.
before we see anything's really coming back to normal. And what should we be doing in that long term? Because 2 more years seems like a really long time. So some of the things that you're going to talk about in session 4 is going to be more detailed along those lines, but some of the things you have on this slide really can be for people to think about as techniques that they can use during this time period, right?
Yeah, absolutely. And let me just say something about, this idea of 2 more years. I don't think we can think of this essentially in terms of it ending quickly. So therefore, when I talk about sustainability of any of these, whether we talk about some of these coping strategies or any that we may have on, our own, you may have your own possibilities. I want to say that we have to think about this as our new normal. And we have to consider that part of what we are really grieving is the way that the world was, and understanding the way the world is now in the here, and what it might be for the future. So any of these things that we talk about, part of the stressor is the fact that we have to then think about creating change in our own life and understanding what can we sustain. And I wish I could, I don't have neither the expertise nor the understanding, and certainly not the precognition to understand what will happen in 2022. So I encourage us, as part of our coping and managing in crisis, is to be present in the here and now. When we talk about mindfulness, practicing mindfulness techniques, essentially what that really means, above and beyond everything else that you might hear in terms of breathing or doing yoga or whatever, what mindfulness really means is intentionally responding to the here and now, staying present. When I talk about that staircase, as opposed to the stairwell, that little step instead of the stairwell, that's mindfulness. It's being present on that step, understanding what can we do here now, and moving forward the best we can. I think if we project too far out, it does tend to overwhelm us. But what I love about that question is the idea of being proactive, is putting together some toolkit, for example. And I think that that's what we called the 4th module. I believe we called it a toolkit for managing coping strategies for managing through COVID. So I think that's part of our goal as we move through our 3 other modules, is the understanding of what kind of toolkit can each of us create that is not only uniquely ours, but also sustainable. It doesn't do us any good if I sit here and say, oh, guess what? Research has found that, wearing red on Thursday will protect you from COVID. Well, if you don't like red and you don't believe in that, that's not going to be sustainable for you, right? So the reason that some of these are up here, 1 or 2 of them may or may not, may or may not be applicable to you. So as we move through the rest of our workshops, and we're going to talk a little bit, each of the workshops will end with a little bit of coping strategies, but our 4th module will really focus on that. But again, the key here, especially today, what we hope that you take away, at least today, is some thoughts and some ideas that you can do right now that are sustainable for you to relieve some of this pressure, to relieve some of this stressor. If you think of our lives kind of like as a cup full of water, and if we don't find ways of controlling it ourselves, then somebody else is going to dump that out for us, right? So when we talk about tools for coping and managing crisis, what we are really saying is, what can we do? How can we control that cup so that we can spill a little bit of that water out so it doesn't overflow and therefore leave us vulnerable to ourselves, to illness, to others, and so on and so forth. So
can you talk a little bit about the other modules, that the other times where we come together? Because I want people to kind of get an idea of, why they should come back every week, that listen in or they participate in this is it's I think really a great hands-on opportunity for people to get information about mental health resources and things like that. So if you would explain what the other modules are about and then the resources, I think we have great things to share.
So these are the other three modules. The second one will be called Health and Wellness During COVID-19. And what we did there is we broke it down. We broke down the journey, if you will, into the dimensions of really the human dimension. We broke it down into the physical aspects or the physical impact of COVID. We talk about the mental and emotional component, the spiritual impact on COVID, and we kind of break that down into what people might be experiencing and what are some things that we can do about it. And we also wanted to bring in there a level of kind of like the miscellaneous aspects of it that people don't talk about, this idea of cumulative loss. And because we felt that loss was really foundational to this journey that we were all thrusted in several months ago, then workshop 3 is really focusing on trying to understand what the grief journey as it relates to times of crisis means. So we're going to talk a little bit about the types of grief and how grief manifests in our life. And like today, we hope that our participants, our partners, really, and I call you all our partners because I think what Tissa and I really wanted from this is not only, we hope that some of what we talked about today is something that will help and allow you to move through this, but we wanted to learn because every time that we have these kinds of experiences, to me as a facilitator, I think it's really important to open myself up to what is it that I need to know from the community that we're serving. And so I've learned so much today from those of you who were able to get through. And because of that, we'll add that to the subsequent workshops. And so workshop 3 is really focused on the journey from a grief and loss perspective. And we, again, will end each of the workshops with some coping strategies and trying to understand the sustainability of this toolkit. So therefore, workshop 4 goes into that toolkit. We will kind of tease out some of these things that we talked about earlier, implementing breathing exercises, expressive arts, music, yoga, and those other mindfulness practice, exercise, those kinds of things. What we really hope to do, it's going to be, I think, I'm not going to lie, I think it's a little bit of a challenge because we're not going to be face-to-face. So we're hoping to really do this in a way that we can actually show. So for example, not only just tell you about it, but take you through some breathing exercises, take you through some expressive arts or music to show you how you can utilize things that are around the house in order to take out that water and alleviate some of those stressors in order for you to refuel and be able to move forward. I heard something the other day, and I think this really talks about workshop 4, and I believe it was something like, I think it came from an IT guy, and it said something like, and almost anything can be helped as long as you push the restart button. And so I thought that was really kind of powerful. What we hope to do with workshop 4 is teach you some ways to push that restart button, reboot, and move through, refuel yourself, and move through your lives. And because ultimately this will pass, I will guarantee you that I feel that in my heart. This too shall pass. We will move through this. We will not only survive this, but I believe we will thrive. And I do believe that as a community, we will be stronger. And I think I believe in my heart that although I'm not a Pollyanna, and I don't think things will, obviously be fixed, there always will be pain and challenges, But I think I'd like to think that as a global community, perhaps we'll be a little kinder, a little more understanding, a little more aware of how interconnected we are, and that what impacts one impacts all. And so therefore, together, we need to move through this because there's no other choice. We have to be able to create communities of empathy, of informed response and kindness, and certainly and that starts by taking care of ourselves individually. And then once we heal, once we're strong, we can then reach out and help others. So for us, I think self-care is critically important. It's not selfish. It is what allows us to do what we want to do, and that is help others. And you can't do that if you don't have the fuel and the resources to help yourself. So I like to kind of close this out by not only thanking our partners and thanking RUR Consulting for allowing to bring us as a Barry University community to this project. I certainly want to thank Dr. Tissa McGee, my colleague, all of you on the production team, but mostly all of you who were able to attend. I know that you had other responsibilities, and for you to come in today after work and so forth, we thank you. We hope that you will continue to come back and share this with your friends and families, because that's the way we can make each of the workshops better and more relevant and more effective. So thank you for all of this. And Tissa, I'm going to move it to you.
I just want to say thank you, Maria, for sharing all of your great clinical experience and especially talking about the brain and our impact. Although we are academics, we are truly community people. I want to say that we are looking forward to the practicality of these sort of seminars, webinars, whatever you want to call them. This programming really is for the community. And so we hope that you will share this, use social media outlets to help get the word out about where we are. And we are actually going to move the workshops back about a half an hour every week. So you'll see them starting at 5:30 instead of 6 p.m. And I just want to say that I feel very privileged to be a part of this team. Feel very happy that we will be sharing those tools, and people are very interested in what things that they can do to help shape how they see and experience this pandemic. And Maria and Dr. Teahan and I are very grateful for all of the sponsors like you mentioned. So thank you so much, and we will see you next week.
Bye-bye.